Today I will be discussing some of the common parts in history taking. Irrespective of the station, what you are getting, these are the things you need to keep in mind. When you enter into this station, what's written outside? Just you have to look at the stem, the name and age of the patient. Just try to remember the name. First name is important. You keep in mind the first name so that you can address to the patient again and again. Age of the patient, whether it is younger patient or older one. Then the stem has got the history related. If suppose it is related with orthopedic problem, the history of fall, injury, any surgery in the past, the football player or something like that. You have to remember these three important things: name, age, and then how was the history happened with this. This is the stem outside. Just 1 minute is there. You have to remember the stem, and then you have to try to make up your mind that once you are going inside, you have to knock the door. These are the common things: knock the door, greet, smile. There is no need to telling your name. Give the candidate number. My number is so and so. To the examiner, smile and be confident. You will be seeing an examiner, a patient sitting or lying down, a chaperone or all that. The first thing you greet, give the number, then sanitize. Don't waste looking here and there. Just sanitize whatever is there. If the pen and paper is there, just try to act like picking it in a professional manner. Pick the just now turn toward the patient. Examiner part is over. Greet the patient. Hello. Myself, Dr. Hamid. I'm your surgical doctor here. And sit in front of the patient. If the patient is sitting, sit at the eye level. Keep the eye level contact. If patient is lying down, just take the chair and sit in front of him. Then start. May I know your name and age, please? All stations, 3 to 4 minutes are common for all stations. How to start? What will be the first question for all stations? What seems to be your problem? How can I help you? Listen. Oh doctor, I'm having knee pain and all that, this and that. Listen and just try to understand the word pain. The person is having knee pain. Just whenever a person is using the word pain, just click in your mind that it is Socrates. Socrates, you have to spend 1 to 1.5 minutes for Socrates. Socrates. The pain. In a natural way, when you are asking the patient pain, immediately you should ask which knee, right knee, left knee, on site. So that is the S is site. O is onset. When does it start? 2 months, 3 months, 4 months, 6 months? Like, what is the character? How is the pain? Dull, aching, burning, sharp, like that. Is it radiating somewhere else? So it should come in a sequence. So pain, where is the site? When it is started? How is the pain? Is it radiating? Abdominal pain, vomiting, nausea, and something else. Associated symptoms. Then E is exacerbating factors. What does it increase the pain? What does it reduce the pain? Then what is the severity of the pain? Mark from 0 to 10. What can be the, how would you like to score this pain? The 3 differential diagnosis in the mind, and ask one question for each DD. Whether it is back pain, you just keep 3 differential diagnoses like lumbar canal stenosis, cauda equina, or it can be lumbar disc prolapse or mechanical or something like that. So ask one question to each. Then immediately the common things for all these stations: red flag signs. So it depends upon the weight loss, unintentional weight loss, blood or blood in the urine, stool or sputum, and like these are the red flag signs. Then the past medical history, immediately red flag sign, past medical history. You ask the history of blood pressure, raised blood pressure or sugar or diabetes, hypertension, like that. Then you ask the past surgical history, any surgery in the past which patient has undergone. Then you use of medications for longer period or shorter period, that is medication, history of medications. So this is key common in the family. If the person is giving the history that, oh yeah doctor, my father has similar complaints and he has undergone surgery, he is trying to consume some of your time. You have to give some time and listen, give an ear to the patient and show empathy when the person is talking about death and all that. Asking the social history. social history is very important. You are asking personal questions. In that, you just try to take the confidence of the patient, and then ask for how much do you smoke. Then if you're smoking, yes, how many cigarettes. Then if patient is alcoholic, how much alcohol does he take daily or occasionally. A personal history for like impotence or something like that. Then comes the ICE. ICE. I is information. Nowadays patients are taking already information. Mr. James, have you got any, what do you think about your disease, what do you think about your complaints, the information they will tell. Then what are the concern. So most of the patients are concerned with pain and they're unable to go for the work, for the job, for playing, for gardening, for any shopping or something. They are concerned with cancers or like that. So try to dig out for their concern. Then what is their expectation? What do you expect from the doctors or the team, from us? What do you expect? So then you have to systematically review. System review means cardiovascular, respiratory, neurological, whatever concern. One question each. Respiratory, do you have any breathlessness, cough or sputum like this for respiratory? Cardiovascular, you have got any feel of the heartbeats like this, or sweating or pain on the left side of chest or this like this, or walking uphill or something like that. Cardiovascular system. Then when you finish the systematic, these are the common things for how to disengage the patient, thank the patient. Okay, Mr. James or Mrs. Smith or something like that. I would like to consult with my senior consultant and I will be back with you. Thank you, goodbye. So here you have to stop, turn towards examiner. The examiner is sitting. Now when you are giving the summary, the summary has to be finished in 30 seconds. The summary has to be the name of the patient. That's why when you write down the patient name and age of the patient, the name Mrs. Unit or like this, age for 60 years, she had a history of fall, and then after that she had past history of doing surgery, or now she is concerned with this, and after taking all this she is diabetic or hypertension. The important negative points are also there. So what you are thinking as to be the main diagnosis? I'm thinking of lumbar disc prolapse or mechanical back pain or this, and possible things can be 1, 2, 3. So it can be this, it can be this, it can be this, and stop here.